Assisted conception is the term applied to a range of fertility treatments that involve handling eggs or sperm or both. In Britain, clinics that offer assisted conception are all regulated through the Human Fertilisation and Embryology Authority. In the United States, a different term is used, assisted reproductive technologies, and their regulatory body is called the Society for Assisted Reproductive Technologies. Over the years, the commonest treatment is IVF treatment. The very first success with IVF was in Britain in 1978, and following on from that, there's been a steady increase in the number of treatment cycles being carried out. A key year in the advance of IVF was 1986. This was the introduction of transvaginal scanning and also new drug treatments for ovarian stimulation for IVF treatment. There was a further big step forward in 1992-93 with the introduction of intracytoplasmic sperm injection. This is when sperm are injected directly into the eggs, and this will apply to couples who previously would have had failed fertilization. Nowadays in Britain, about 1 in 50 babies born are born as the result of fertility treatment, so it's no longer the rare and unusual that it was at one time. Nowadays, many children aged 8, 9 and 10 will know someone else at school who's been born as a result of fertility treatment. The best known assisted conception treatment is IVF, or to give it its full title, in vitro fertilization, which involves stimulating the lady's ovaries, collecting eggs, fertilizing eggs in the laboratory, and then subsequently transferring an embryo or sometimes 2 embryos back to the uterus. If there's concern that the sperm might not be able to fertilize the eggs, the sperm can be injected into the eggs one by one, and this technique is called intracytoplasmic sperm injection, or ICSI. A much simpler treatment is intrauterine insemination treatment, which can be done in either natural or stimulated cycles, and there's also the option with this treatment to use donor sperm if it's a single lady or if the man does not have any sperm of his own. Going back to IVF treatment, some women go through IVF but their ovaries don't respond, and then there are some women who have an early menopause. And for those women, there's the option for treatment with donor eggs. So she will have the donor eggs fertilized with her partner's or husband's sperm, and then embryos transferred back to her uterus. If there are surplus embryos to requirements for the fresh cycle, so if after having transferred 1 or 2 embryos, there are good quality embryos remaining, these can be frozen and then transferred in subsequent frozen embryo replacement cycles. An additional option with IVF treatment is to biopsy the embryos. There are 2 techniques: pre-implantation genetic screening and pre-implantation genetic diagnosis, and this ensures that only normal embryos will be transferred back to the uterus. Some women will undergo IVF treatment but have their eggs frozen rather than having the eggs fertilized. This might be a woman who's about to start cancer treatment and wants to collect and store eggs before she starts on chemotherapy or radiotherapy. And then there are also women who want to freeze eggs for future use in case they might be infertile in future years. Over the years, there's been a steady increase in the number of couples and single women who are wanting to access assisted conception treatments. Of the various treatments available, IVF has proved to be the most popular, and this is for a variety of reasons, not least of which is the fact that it's become more successful over the years. There's a number of social changes that have also driven the increased demand for fertility treatment, and in particular, many women nowadays choose to delay having children into their 30s, which unfortunately increases the chance that there might be difficulties getting pregnant. The NHS has provided funding for some couples wishing to pursue IVF treatment, but unfortunately there are often restrictive criteria which mean that a lot of couples who wish to access treatment are not able to secure NHS funding. Another treatment that's proved popular is frozen embryo transfer. So this is for women or couples who've been through IVF treatment and there have been good quality embryos surplus to requirements that have then been frozen, and they can then be transferred in subsequent frozen embryo replacement cycles. More recently, social egg freezing has become particularly popular, and this is for women who are anxious to defer having children until later years but do not want to run the risk of being infertile. These women will go through all the stages of IVF treatment up to and including egg-collection, but then have the eggs frozen. In future years, if they're unable to conceive naturally or with fertility treatment, there will then be the option to go back and use the eggs which were frozen when they were younger. The success rate with IVF treatment is particularly dependent on the woman's age. As the lady gets older, her eggs age with her, and the older eggs unfortunately do not perform as well in terms of fertilization and developing into good quality embryos. Another key reason that affects the chance of success with IVF treatment is the reason why the couple are having IVF in the first place. So for example, if the woman is perfectly healthy and the only problem is with the man's sperm, she will have a better chance of success than a woman who's had complex gynecological problems and maybe previous surgery. An example of this would be a woman who'd had complex surgery for endometriosis. If the couple find, if the woman finds that as she gets older the IVF treatment is not working, there's then always the option to look at donor egg IVF treatment. And with a young healthy donor, success rates with donor egg IVF treatment are very good, and this is reflecting the age of the egg donor rather than the age of the woman who is the recipient. Success rates overall in the up to 35-year age group are approaching 50%, but with increasing age the success rates decline, and after 40th birthday success rates, well, 20% would be the upper limit in terms of the chance of success. If we look at success rates with intrauterine insemination treatment, these are never as high as with IVF treatment, and typically success rates will be in the 10 to 15% bracket, sometimes a little higher than that. So with the IUI treatment, it's better to think of it in terms of a course of treatment rather than a single treatment cycle. Overall, assisted conception treatments are very safe, and there are actually very few risks associated with treatment. A particular concern has been the increased number of multiple pregnancies. Many couples will view a twin pregnancy as a bonus, and that's quite understandable. However, when we look at twin pregnancies overall compared with singleton pregnancy, they are more prone to complications. So ideally what we want with a twin pregnancy is two healthy babies and a healthy mother, but occasionally the outcome is not as we'd wished. An easy fact to remember is that on average twins are born a month earlier and weigh a kilo lighter than their singleton counterparts. Because of the risks associated with multiple pregnancy, there's been a move over the last, well, more than 10 years now to transfer fewer embryos. This initially started in the Nordic countries and then spread to Europe and Britain and subsequently the United States. So increasingly now we're just transferring one good quality embryo rather than two, and this is to reduce the chance for a twin pregnancy. Another complication with IVF treatment, which is uncommon but it's important, and this is ovarian hyperstimulation syndrome, when the ovaries over-respond. Because of the risks of OHSS, as it's abbreviated to, we're now more cautious about how we stimulate ovaries, and this particularly applies to women with polycystic ovary syndrome. Other complications from IVF treatment are quite rare. This might be bleeding at the time of the egg collection, or following the egg collection with an enlarged ovary. This can undergo torsion, requiring an operation to untwist the twisted ovary.